as I said, we're going to attach this to your lower abdomen just right here. A nurse is going to do it. Your muscles make electricity. As you get tense, you make more electricity. So this machine is just going to pick up the patterns of electricity. And I'll show you that up on the screen in a second. What we're also going to do is record from your vaginal canal. That's the best place to put a probe to catch the electricity that the pelvic floor is making. And don't worry about the apparent size of this probe. This is a little probe that we use. This gets inserted into the vaginal canal. What you do is, this is sealed, as you can tell, it's never been used, okay? You're going to put a little KY jelly on the probe. You're going to go in the bathroom when you're doing this. So you'll open this, put some KY jelly on it, slip it into place. You can only go really in one direction, okay? This handle can't go sideways. There's a wire on it. Not for long it won't. See how there's a little wire sticking out the front? See the wire? That's the side that comes forward. Okay, so it just slips in like this. And what I want you to do is adjust yourself so that the wire, it might be easier if it comes out through here, about, between one of these buttons. So when you've got that on, then you go in the next room. Annette will go in with you, put on the sensor here, and she'll run the other wire out. The wire for the abdomen has got a label on it, okay? So we'll know which one is which. We're not going to get confused. I just have to ask you whether you've been examined by a physician or a nurse specialist for any problems in your pelvic floor. Do you have any cuts there or infections? Okay, then this is probably safe to do. I've worked with many hundreds of women who have urinary incontinence. We've never ever had any kind of an accident or problem in an actual clinical situation. Here's what we're doing. Make believe that this red line is the amount of electricity produced by your lower abdomen, and the blue line is the amount of electricity produced by your pelvic floor. If we were to tell you to tense up, first of all, there'd be very little electricity before you tense up. As I said, your muscles make more electricity when they tense up. Can you folks see that? Can you see that? Okay. Before you get any training, what's probably going to happen, if you have a problem with continence, is your abdomen will tense up, even though we say leave your abdomen relaxed and only tense your pelvic floor. The abdomen will tense up, okay? And it'll take the pelvic floor a long time to tense up, but it won't tense up as much. Then we're going to say, stay tense for 5 seconds. And there'll be a screen up here that looks just like this, okay? You'll see this kind of a thing, only it'll be really you sending out the signals. If you're not trained, your pelvic floor probably won't be able to stay tense for 5 seconds and will kind of go down, but the abdomen will stay tense and go down, even though you weren't trying to tense this, okay? So this is the wrong type of a pattern. What we would do if we find the wrong pattern is teach you to correct it so that it's the pelvic floor that goes like that. And we teach you to do that by watching the screen and trying different things to make it work. And we give you exercises to do at home. So that's what we would do if this was an actual evaluation and an actual treatment. But please understand, this isn't the real thing. This is practice for a class, you're volunteering. I haven't even begun asking you about what your symptoms are and whatnot. I don't even know if you want to discuss that. That's something you don't. It's fine. If you're a real patient, we would talk about it. We would have you keep a little log of how much you're leaking, things like that. Okay, so we don't know. So this isn't a real evaluation. You're just a volunteer for that, and we appreciate it. So I shouldn't have just said just. Also, I'm not licensed in New Zealand. As you can tell from my accent, I'm not from around here. This isn't typical Palmerston North. So I'm not licensed. So I can't, anything that we find, we can't write it up and send the report to your doc. But this could give you guidance to help you think about where to go next or to get a formal evaluation if you need one. So does that make sense so far? Okay. Do you have any questions? Any of the three of you? Okay. Well, if you're ready, we can go ahead and get started.